In the meantime, what are some of the more common sports injuries that you see in your practice?
Well, I love sports, so the eye sees what it knows, right? So I elected to go into sports medicine, so I see a lot of sports injuries, and that doesn't necessarily have to be a collegiate athlete or a high school athlete. I see a lot of weekend warrior athletes. So the most common thing I see, we can even break it down. Knees, it's going to be meniscus tears. They're the most common thing I see. ACL tears in younger athletes, even the weekend athlete, in the weekend warrior athlete. Shoulders, I see a lot of rotator cuff injuries. I see a lot of bursitis, so we can talk a little bit about that.
Bursitis?
Bursitis is basically inflammation of the bursa, which is a thin layer of tissue that surrounds the rotator cuff.
The rotator cuff.
The rotator
okay.
cuff.
You've got a little model
Yeah.
that you can show us. We got some show and tell going on here.
That's right. So this is the shoulder, right? And the red stuff here is the muscle, right? So the rotator cuff is a series of 4 tendons, right? The 4 tendons attached to the humerus, which is the bone of the shoulder, right? So the rotator cuff are the muscle tendon units, so muscle tendon, that help the shoulder lift up, help us to do certain activities like throw a baseball or swing a golf club or even reach to put some dishes on the shelf.
Or to get a snack.
Or get a snack, especially in a late night, So the rotator cuff is a very important structure. So what bursitis is basically the covering of the rotator cuff. Now it's a very thin layer, and everyone has a bursa. You don't really know it's there unless it starts to hurt.
Okay.
And so it's just basically inflammation of that sheet of tissue that covers the rotator cuff. The bursa helps to let the rotator cuff move more fluid, and so when it becomes inflamed, that's when you start having a lot of shoulder pain on the side. Wakes you up at night,
Yeah, because you're moving around in the bed and then it wakes you up.
It's the most common thing that patients complain about. It says night pain. It says I can't sleep on that side because it bothers me at night. Sometimes during the day it gets better, but at nighttime it really flares up.